Hey there, nurse family. Natural RN here. Wanted to talk to you guys today about pros and cons of working in an operating room setting as a nurse circulator. As with any job, you're going to have pros and cons, so this one's no different. These are just a few of mine, so let's just jump right into it. Okay, so I'm just going to go ahead and start with the pros, and for me, pro number one is the hours, actually. So with working in an operating room as a nurse circulator, you can either work 8, 10, or 12-hour shifts. I personally like that. Coming from working on a floor, a med-surg floor, where I worked nights and weekends and couldn't tell you what day it was from time to time because I would be so confused from the odd hours. I love the fact that I get to get up early in the morning, go to work, come home 4 or 5 o'clock. I get off work, sometimes even earlier than that, depending on, the workload of the day. So I just like, the daytimeness, the work-life balance. I get to work out and do things that I need to do for myself. Still come home and it's still daylight outside, so I have time to do things that I need to do. And not working on the weekends as a nurse is so awesome and so rare because there's a lot of nursing jobs, you're required to work weekends, which sometimes you do have to work weekends in the OR, but we'll get to that a little bit later. Another pro, having one patient at a time. I mean, come on. If you've ever worked on a floor where you have multiple patients at one time, like a med-surg floor like I did, where you have 5, 6, 7 patients at a time, they all need you at the same time, you have to pass meds before a certain time, you have to talk to this family and this doctor, and it can get crazy. It can get kind of overwhelming sometimes. So it's kind of refreshing, to say the least, to have one patient to deal with. And you have like a whole team of people that deal with that patient with you. So you're not doing it by yourself. The team consists of like anesthesiology, you have the surgeon who's actually doing the surgery, you have the nurse circulator. It's just a whole team that's taking care of this one patient that we're focused on. And the one patient is sleep, by the way. Come on, they're not even awake. You're just taking care of them, making sure that everything is going well. Because they are asleep, you're the voice for that patient, so you have to make sure that they're being taken care of, they're being treated with dignity, they're having the surgery that they signed consent for. But it's very, very good to have one patient compared to having 5, 6 patients sometimes. So that's a plus. Definitely I would say not having to worry about your hair or your clothes or maybe even makeup sometimes is definitely a pro. Okay, so you have to wear a hat over your head the whole time you're in the OR. No one can have their hair out in that type of setting. So if you don't want to do your hair, or if you're having a bad hair day, no one's gonna see it anyway because you have a hat on. So it definitely saves a lot of time, and it definitely saves me a lot of time in the morning because, as you can see, I have a lot of hair. So that's definitely a time saver. Also, a lot of facilities that you work with are going to provide you with scrubs themselves. So you go to work and pick up your scrubs. You don't have to come home and wash all these scrubs and then, because they launder them at the job. So you just pick up the scrubs there and you leave them there and you come back the next day and you do it again. Also, you're going to have a mask on all day. So what are you putting makeup on for? You don't even need it. No, I still wear makeup too. But I'm saying you don't have to wear makeup really, because we're going to have a mask on all day, especially during this pandemic thing. The only time I take my mask off at work is on my lunch break when I'm eating, to be honest. So that's definitely a pro for me. It's definitely a time saver. It's definitely low maintenance. So that's definitely a pro. The last pro I'm going to talk about today is a pretty big one for me, and that's just seeing a variety of surgeries. The stuff you see in the operating room is you just never thought you'd see before. If you're a nurse that likes, doesn't mind blood and likes seeing someone's inner anatomy, this is definitely the position for you because you're going to see all different types of surgeries. Things that I I never thought I would see before. Like I've seen all kinds of vascular surgeries. I've seen robotic lung surgeries. I've seen kidney transplants. I've seen amputations. Oh my gosh, like we amputated a patient's leg and I like had to take this whole leg to the lab for like a specimen. I mean, I personally think stuff like that is just pretty cool. I remember being in nursing school during my clinical rotation, and the first time I went in the operating room, they were doing like this huge back surgery. I mean, they had all these rods and screws and everything. And the doctor that was doing that surgery, he calls me over. I guess he could see the excitement in my eyes because obviously we had on masks. So it was like, come on over here and take a closer look. So I stood on a stool because I'm short, and I was looking down at this patient's back. It was just like wide open. And I'm like, oh my gosh, like that is his spine, like just right there. So the stuff that you see in person, it just does not compare to like an anatomy book or anything like that. So for me, it's definitely a pro. All right, so let's jump into some cons here because you know we have them. For me, definitely number one con, taking call. I don't like it. It sucks. Pays great, you know, but I just don't like call. I don't know how else to say it. Basically, being on call is like being on standby for when an emergency happens or if an emergency happens. So if you're on call and you're at home, you know, and an emergency surgery comes up, they're going to call you and tell you that, you know, you have to come in. And you have like 20 to 30 minutes to get there from the time of the call. And you go and you do the surgery for however long it takes. You know, you're on call 24 hours, sometimes 48 hours, depending on maybe if you're doing like a whole weekend. And within any time of that 24-hour period, you can get called in. You can get called in at 7 a.m. You could get called in at 2, 3, 4 o'clock in the morning. You have to go and do that. So for me, the being on standby and the being on edge and waiting to see if you're going to get called or not, I don't like that. Because you could be on call and not get called in at all, but you haven't enjoyed your day because it's on your mind, you're thinking about it. You won't let yourself fully go to sleep because you don't want to miss the call or like oversleep. And I just don't like call, to be honest. It's a con. Another con for me is also a pretty big one, and it's kind of one that, you know, I kind of deal with from time to time. And that's just everything that used to stress me out or bother me as a floor nurse are the very same things that I miss being an OR nurse. So having that patient interaction, you know, passing medications to patients, helping them feel better yourself, having your opinion valued by the doctor that's treating that patient because they know that you know that patient and they trust your judgment. So they'll ask you questions about, you know, what they think, what they want you to do as far as the treatment plan goes and what your suggestion is about that and stuff. So those are the things that I definitely miss about nursing, because in the OR, there's little to no pharmacology on your part, so you're not passing medications. The anesthesia team does that. You know, there's no doctor asking you in surgery, hey, you know, nurse circulator, what do you think we should do for this patient, or what is your suggestion? They're not going to ask you that. They're going to ask anesthesia because anesthesia is giving the medication. The only nursing skill that you still use is putting in Foleys. I mean, I'm a pro at putting in Foleys. I could put a Foley in with my eyes closed at this point. I've done so many. But, you know, you miss your skills that you learned as far as doing IVs, you know, passing meds, and, you know, physically saving a patient's life. I mean, I would go into a patient's room sometimes and maybe they'd be choking, or maybe they'd, you know, be in some type of respiratory distress, and it was up to me to save that patient. You know, sometimes you don't feel as much of a nurse coming from that environment. Some nurses go straight into the OR from nursing school, so they've never had that experience, so it's fine. But if you've ever been really great as a nurse and had all these nursing skills, and you know, people ask you for your opinion and your help and things like that, to come into the OR where you don't really use any of that, it's definitely an adjustment, and it's definitely sometimes I miss those things. So that can be a con sometimes as well. So my last con I would say is that as a nurse circulator, there is not much more that you can do than that. There's not a lot of room for growth in that area as far as a nurse goes. It's like you become an RN circulator, and then you can get your certification in OR nursing, but you have to have been an OR nurse for 2 years. I've only been doing this for a little over a year now, so I can't even get that yet. But other than that, as far as being a nurse, that's pretty much it. Like, you're not going to get any higher than a circulator in the OR. For me, it's about continuing my education. So at this point, I'm still trying to figure out, you know, what my next move is going to be in that, as far as like if I want to do nurse practitioner or physician assistant. These are things that I see people doing in the OR that I could possibly do. Even being a first assistant, you know, just to probably be a little bit more involved in the surgeries. So just trying to figure out education-wise what I want to do next, since I pretty much have another year until I can get my CNOR. So just something to think about, but there is not a lot of room for growth as far as that goes. So that's a con. So anyway, people, that was my list of pros and cons of working in the operating room. That's definitely not a complete list, but I didn't want this video to be excessively long. But those are just some of my pros and cons. Not, you know, like I said in the beginning, they're not everyone's. You know, some people like to take a lot of call. A lot of people, you know, they have their own experiences, and these pros and cons are just based off my own personal experiences. So if you have any personal pros and cons that you would like to discuss, I suggest you list those down below in the comment section. And please like and subscribe to this channel. And I appreciate you guys for watching my video, and I hope y'all have a wonderfully blessed day. Thank you very much, and see you in the next video. Bye.